So I'm just going to show you how to set her up, and then I'll get scanning and just kind of talk you guys through it. And then next week for lab, you guys can just dive right in and start. And you'll be with your same lab partner from the morning, or from whoever you're going to be with over the other time that week. And yeah, cool. All right. So if your bed will go this way, angled downwards, the reverse Trendelenburg or whatever it is, that's a really great way to start, because then the blood kind of pools in their legs. And
and I have varicose veins.
Okay.
I've had them ablated on the left side,
all right,
but not the right, so it may look funny.
Okay. Yeah, we'll see. We'll see if she's got some reflux. So yeah, so you'll have her set up, feet down, and then you'll have them bend their knee and kind of frog leg out. So I'll just have you rest your foot. Yep. And then you'll take the towel, give it a little tuck up into the side of their shorts. And I will tell you guys, if you haven't scanned these yet, it's higher than you think where you're going to start. It feels like you're like going a little inappropriate. Okay. That's just how it is. Okay. Let me find my warm gel. All right, so you're going to start up in the groin. You're looking for common femoral. Make sure your machine settings are on venous, and that you're set yourself up for success. All right, so right away you can see we've got veins and arteries happening here. So you're going to scan all the way up until you just have 2 vessels. Okay, so right now we have our common femoral vein, common femoral artery. So this is going to be our first image. So you're going to basically do a split screen. So I'm going to do a little split screen here. So I'm going to do an open image of the common femoral vein. I'm going to toggle over to the other side, and then I'm going to do a compression. So we have it fully compressed, the sides of the vein completely coagued, and then so we have artery, vein, and then just the artery. So that's our first image. That's it. And then we're going to go back and look for her greater saphenous. So we can see it right here. It's always going to come in medially. Now the greater saphenous is an important vein because it's superficial, so it doesn't have a paired artery with it, but it is a vein that we want to worry about, because if she did have a clot in the superficial system, this is where it could possibly enter the deep system and start to cause problems. So we want to make sure we're assessing that, and hers is kind of tiny. So just, you can see it right here, and that could have something to do with the varicose veins, because varicose veins are usually superficial. So we'll do the same thing, keep an open one, go to the other side, give it a little squish, and that's our second image. All right, so then we get to what I call the most complicated image. So we're going to start to hop down her leg, and just make sure everything compresses as you go. And you're going to see the vein split into 2. So right now it's 1, and boom, right there you see now it's 2 veins. Let's see, right there. There we go. So there's 2. So now we have 2 arteries, 2 veins, and hers is configured a little bit funky because she's got an artery, vein, but that's okay. It doesn't mean anything. Everyone's a little bit different, and that's what's hard about legs too, because people are like, the configuration of how their vessels sit is a little bit different in all of us. And then it also depends, like if you have someone that's an athlete, sometimes they have more branches than someone who is more sedentary. So especially if they were like an athlete as a kid, they kind of grew extra branches.
That's
So,
why is that?
because their legs need more blood, or drain more blood, so it just grows more pathways. So kind of cool. Okay, so now we have our 2 veins. You can see right there, they squish. And let's see, Kim's trying to come.
Hopefully they squish.
Yeah, I'm like, they're squishing.
Kind of.
I'm trying to figure out. This always happens every time I do a demo. I'm like, no. There's the vein. So that's profunda. And you can see on her, this is just a long view, but you have your common femoral vein. It splits into the femoral vein and then the profunda. And hers right away, she's got an extra branch like right here. So, fun stuff. Okay, so we have our femoral vein and our profunda. So we're gonna do two separate images. We're gonna do one of the profunda and then do our little compression, squishing him to death. Sorry, but I know it's like, and then we will do another one where we're doing the femoral vein. And compress that one. And then from there, the profunda is gonna dive. So that's really the last place we're gonna evaluate it unless you just happen to see it. And then we're gonna start making our way down her leg. And we're gonna look at the femoral vein, upper, mid, and lower. And you might see it clinical, them calling it prox, mid, distal, which is true for the leg, but technically in the venous system, this would be prox. So it can get confusing. And so if you use upper, mid, lower, you're always covering your butt. Or you could say like proximal leg, distal leg. But I always just say upper, mid, lower because that's gonna keep you from confusing anybody. I had a radiologist that was like a crazy person about, this is distal and this is prox, and it was annoying. So we'll do the same thing the whole way down her leg. So we'll do an upper femoral, we'll hop our way down, just make sure it compresses. And there's not really a marker, you're just gonna kind of look where you are. So I will usually just divide their leg into thirds and say like, okay, this is my upper, my mid's gonna be about here, my lower is gonna be about here. So we'll do a mid, compress, and then we'll do our lower. And all the way down. And for lower, you just wanna go almost to like the last place that you can evaluate it successfully. Sometimes if you come a little more medial on their leg, you can see it a little bit better and you can compress it a little bit better because of the way that the muscle and the bone runs here. It can be a little bit hard to push down. So if you kind of come more to the fleshy, like back of their leg, it can be a little bit easier. So then we'll call that her lower. Give it a good squish, done. And then we'll move into her pop. So I just compress all the way down as far as I can go. Let's see, hers is great, you can still see her, everybody's gonna want her for the comp. And then we'll go to her pop vein, right behind her knee. You might need to have them straighten their leg just a tad, and then from here, so then from here, sometimes you may also need to increase your gain a little bit. It's just kind of more shadowy back there. So we'll find our vein and our artery. So there's her pop right there. So you can see the vein and the artery. And so I'll take that, do my split screen, give it a good squish, and that's her pop. And then we are gonna go back up to the top. Some places you'll see they'll go all the way down. But for our purposes, we're gonna go back up to the top and we're gonna do everything in long. So we're gonna do her common femoral vein and long. We're gonna go all the way up and then turn. To get that nice long image, and we'll do a color image of that. And we're catching a little bit. You can see how the artery and the vein like run really, really close to each other here. So it might be a little bit annoying sometimes when you get both. And you also may run into like their shorts or the towel, and that can be a little bit annoying. That's what's happening right here. So we'll take our color picture, and then we'll do a pulsed wave image with the waveform. You can see that artery flow is getting in there too. Okay, so there's her vein, and we're gonna do an augment. So we're gonna go below her knee, and then give it a little press to augment. And what that's gonna do is push the blood up the leg. And if she had a clot between where I'm squeezing and where I'm scanning, we would have some sort of disruption of the flow, in theory. So it's proving that we can push the blood all the way up her leg and everything's functioning normally. Does that make sense? So then we're gonna do that the whole way down. So I'm gonna get her greater softness. And all the buttons. Now the greater softness sometimes doesn't augment well because you have to kind of squeeze the right place for it. And sometimes it just doesn't work and you might not be squeezing the vessel the right way. Hers is so tiny. And it could be with hers, we might have some issues because if she's had any issues with varicose veins, it could cut you down. So that would be your color. Let's see. You can see it's just
not really doing anything.
terrible flow.
Excellent.
But let's see. So we got a little bit. Let's see if I can get a little augment there. So sometimes you can get the augment, sometimes you can't, but with that one, you don't want to squeeze below the knee because it doesn't connect. So you need to squeeze more like upper thigh. Okay, now we're gonna keep making our way down and get to that split that we saw before. All right, so here we have her common femoral, we have the femoral vein, and then we have the profunda. So we're gonna pick one. Usually I start with the profunda because you're gonna follow the femoral all the way down. And so when they have a split like this, you wanna make sure you put your gate before the split, that main branch, okay? So we'll put our color on there. I'm gonna steer my box. What? This is like really jacked up. Where's the other way? There we go. So this is when you've got to start doing all of your adjustments. So there we go. So we can get our flow. And you just want to wait until it fills in nicely. If you can't get it to fill in, sometimes you can squeeze below. Do an augment there as well. So there's our first image, and then we're going to add our Doppler. Let's see. Back. Our Doppler. And I'm not setting an angle with my Doppler because I don't need to, because we're looking at a vein. So I'm not worried about it, okay? So your other option, instead of squeezing, is to have your patient flex their foot. So just pull your toes towards your knee. There you go. And that's your augment too. So either way, it works. It's nice if you have really like short little T-Rex arms like me. You can't reach. It's a nice option to have. All right. So when you're doing your augment, you want to make sure you show some phasic flow first and then do the augment. So you don't want just the augment there. The other thing to pay attention to is if the augment is not super clear, you'll need to write on here like augment so that when I'm grading it, I know that you did it. Or if you're working, it helps the radiologist too to know that you did do the augment. All right, so we're gonna go down here and we're gonna do her femoral vein. There it is right there. So we'll see if we can get that to fill in. And you might need to cine back a little bit, but here's where we're looking. And then we'll do our Alright, give me a little toe pull. Beautiful. So we've got a little arterial that we're catching. I could mess with that and tweak it, but I don't want to keep you guys here forever. But you can also bring your gain down too. And get rid of it. And sometimes that is why your gain is just too high. So then from here, we're just going to take it all the way down. So we're going to follow that femoral vein. And I'm going to go to about mid down her leg. Trying to keep it in my image. And then so we'll do mid, and then we'll do our pulse rate. You can also bring your scale down here too, if you want your wave a little bigger. And flex for me. Beautiful. So then I've got a couple cycles of phasic flow and then my augment. And then we're going to keep going down. And just kind of scan until we get into her lower part of her leg. And then gel. and I just had to take my scale down a little bit because it wasn't picking up the low flow of the vein. So I'll do the color. Come on. Looks like she might have a little branch right there, but that's okay. So with your color, and then you'll do your pulse wave. And flex for me.
Sorry, I did it twice.
Oh, sorry, you got it. And so then we'll go down to her pop, and we'll do the same thing. Make sure we're steered properly. So then we got our pop vein, and then we'll do the pulse wave. And flex for me. Beautiful. And that's it. Make sense? Any questions? So that's what we'll be working on next